Okay, that bunion, let's start there. There's a lot of things you could do. But that bunion, and anticipating this interview, I was looking at your website, and remarkable results. I guess that's a big change. Tell me the process. I mean, what are you doing surgically?
Surgically, the bunion is essentially an enlarged bone caused by abnormal mechanical forces on the foot over time. And essentially what we need to do is decrease the bump on the area and then cosmetically close it so that the patient, essentially after the surgery is done, themselves may not even realize that anything's been done, and nor will anyone that looks at it afterwards.
You're saying the incisions are hidden?
The incisions are, they're discreetly hidden on the side of the foot, which is very different than what most surgeons will do.
Okay, well, what is the standard approach then?
Most people are taught in surgery, either in the orthopedic or podiatric communities, to make incisions more on the top of the foot. The access is easier, and it's just a simpler procedure to do it that way. But cosmetically, because everyone scars differently and oftentimes people have a discoloration over the area of the incision, it's not the most cosmetic way.
Dr. Lee, you mentioned, for example, a bunion. It happens over time. At what age should people do something about it?
Oftentimes it's in their 20s and 30s where most people will step forward to do something about it. Obviously they've recognized they've had this problem for years, but it's really after they've exceeded and gone into their adult ages that they actually take action upon it. Most of the time people will live with it for a while.
They just wear big shoes.
Yeah, big shoes, wider shoes. They don't wear the shoes they really like, or they'll just suffer through the process and then finally get so fed up with either the way it looks or the way it feels that they say, what should I do about it? But interestingly enough, a lot of people wait.
So a lot of late 30s, early 40s can have these big bunions, and they avoid wearing open shoes.
Yeah, they'll avoid wearing open shoes, but they'll wear shoes that really fit the mold of their foot, and very pointed, or they'll just wear sandals sometimes just to get it looking in there.
But those type of things are covered by insurance. Is that right? Because there are people that are watching this that I guess wait, and they wait. My mother is one of them that waited until her late 60s before she had this removed. Are you saying it's possible that in certain cases, if it's causing them discomfort, if their toes are starting to turn, that it's covered by insurance?
Yes, and most of the time it does cause a level of discomfort. What I find is that most people's bunion conditions are a mixture between discomfort and cosmetic looks, but almost everyone has a physical ailment to some degree because of it. One thing that I encourage patients to do and to consider is that now that they know that something can be done about it, is don't wait too long.
So what is the downtime? Somebody watching this, they have a big bunion. What is it? I mean, could they go back to work the next day, the next week?
My general rule on the situation of people, because that's one of the most common questions I get asked because it is a foot problem and we all need our feet to walk on, is that if a person works more than 80% on their feet, they're going to have to take some time off, roughly about 4 to 5 weeks. Okay, of altered work, because most of the time, 90% of the time, they can work, but we're concerned about swelling. Now, if a person is seated most of the time, and I say 75 to 80% of the time, they can really go back in a week because they can elevate their foot on the job and they don't have to walk on their foot a lot, which may cause swelling.